How does FAP genetic risk affect your colon health? Imagine a tiny change in your genes that can have a big impact on your health. That's what happens with familial adenomatous polyposis, or FAP. It's a hereditary condition caused mainly by mutations in the APC gene. This mutation leads to the growth of hundreds or even thousands of precancerous polyps in the colon and rectum, often starting in adolescence. These polyps are small growths that look harmless at first, but they are actually the early signs of potential trouble. If these polyps are not detected and treated early, they almost always turn into colorectal cancer. In fact, most people with FAP develop cancer by the age of 39 if no preventive steps are taken. FAP is inherited in an autosomal dominant pattern, which means just one copy of the mutated gene from either parent can cause the condition. Because of this, if a parent has FAP, there is nearly a 100% chance that their child will also inherit it. This high risk makes early detection and management crucial. Without intervention, the risk of developing colorectal cancer is almost certain, making regular screening essential from a young age. Doctors usually recommend starting colonoscopy screenings between ages 8 and 15 to keep a close on polyp growth. Managing FAP involves a lifelong commitment to surveillance. Regular colonoscopies help detect and remove polyps before they turn cancerous. However, because of the sheer number of polyps and the high risk of cancer, many patients eventually need surgery to remove the colon altogether. This procedure, called a total colectomy, significantly reduces the chance of developing colorectal cancer. Sometimes the rectum is also removed, depending on the extent of polyp growth. Besides the colon, FAP can also cause other health issues, such as benign tumors in the abdomen called desmoid tumors, and increase the risk of cancers in the stomach, duodenum, thyroid, and liver. That's why comprehensive care involves monitoring these areas as well. Genetic testing plays a vital role in confirming a diagnosis of FAP. It also helps identify family members who carry the mutation. If someone tests positive for the APC gene mutation, early screening and preventive measures can be taken. Starting colonoscopy screenings in childhood or early adolescence allows for early detection and management, which can save lives. It's important to remember that each person's experience with FAP can vary, and medical decisions should always be personalized with a healthcare professional. In summary, the genetic risk from FAP has a profound effect on colon health by causing the growth of numerous precancerous polyps. Without intervention, the chance of developing colorectal cancer is nearly certain. But with early diagnosis, regular surveillance, and timely surgery, individuals with FAP can significantly reduce their cancer risk and maintain better health. If you have a family history of FAP or are concerned about your risk, talking to a healthcare provider about genetic testing and screening options is the best step forward.